Okay, welcome to week 4 of our Integrated Behavioral Health Policy course. So hopefully you'll see a natural flow here in that we kind of took a look at the overview of what's happening in primary integrated behavioral health care from a macro point of view. We looked at some current events that have cross sections with integrated care or lack of integrated care. And last week we looked at pieces of legislation that are probably the two most directly tied to integrated health in terms of importance and relevance. So now we move on to integration in primary care. And so usually when people say integrated, and perhaps you notice this in some of the stuff that you read, generally when people talk about behavioral health integration, they most immediately are talking about and thinking of it in the primary care site. And perhaps as well they should. Does seem like the best place to start when we talk about behavioral health care in specific areas of health and medicine. It has heightened importance today, in my opinion, because more and more the burden of prescribing psychotropic medication is going to fall on primary care due to lack of ability of psychiatrists, as well as the cost of seeing psychiatrists and the trend among behavioral health practitioners, especially psychiatrists, to refuse to take insurance for all the reasons that we've been reading about in our hot topics and our landmark legislation. So the upside is that for me anyway, in my private practice, where people in a community where people have almost no access to a psychiatrist unless they are quite affluent, that I'm able to coordinate with primary care, the local primary care, often relatively successfully in terms of being able to get people when appropriate, the medication that they appear to need without access to a psychiatrist, or at least access to a psychiatrist in a timely manner. So, so that's kind of the theme of this week's, and I hope you enjoy all the content. There's lots of stuff in here that in this week that I really feel very strongly about and excited to share with you.